maybe we can get started. I think people are joining us. So good morning, good afternoon, good evening, everyone. Welcome to this session, and thank you for joining us today. We're excited to have you here, and hopefully this is a productive and engaging session. Our speaker here for this session is Dr. Tobias Ladner. He's a digital solutions lead at Roche. He'll be diving into how the Data Computation Platform embodies the resilience to surmount challenges and propel collective progress in the era of Pharma 4.0, as we call it. Before we dive into the content, just a couple of quick guidelines on how the logistics will work. So the session is roughly 20 minutes long. We'll reserve the last 5 minutes of this session for some Q&A. We'll encourage you to ask questions, so feel free to post your questions in your Q&A tab of the Zoom chat, and we'll keep collating those questions. And then during the Q&A session, we'll handle them. If we run out of time during the Q&A session, we'll set up a breakout room for you and the speaker. That way you can engage with him separately. And if you still have residual questions, we can then handle them through emails or other forums. So with that, Tobias, I hand it over to you.
Sure. Thank you very much for the kind introduction. I will go ahead and start sharing my screen. I hope everyone can see the presentation now. That should be good. Yes. Okay, perfect. Then also from my side, welcome to my talk about bridging innovation and compliance in Pharma 4.0, where I will elaborate a little bit about our open source, which we're planning to open source completely, the Data Computation Platform. And with this, I would like to thank you also for getting the invitation to the summit here. I think it's a very interesting and engaging summit that we can have here together. To start, I would like to introduce the company that I'm working for. I guess most of you know that company, but just to make sure that we're all on the same page, I'm working for Roche, one of the biggest pharmaceutical companies, which was founded in 1896, so 29 years ago in Basel. And here on the picture, you can see the lovely heart of Basel, the two Roche towers. Roche itself is investing a lot of money in R&D, and you can see that the group sales were across around 60 billion in 2023. With more than 100,000 employees, we were able in 2023 to treat more than 22 million people with our medicines. And I think you can estimate a little bit the impact of Roche, the company, with the fact that 45 of the medicines, as well as 90 of the diagnostics, are part of the WHO list of essential medicines and tests.
Tobias, just a quick thing. I'm still seeing your first slide only. I haven't. It could just be me, but I'm still seeing only the title slide with your name and.
Then let me check if that works now. Now you should see a switch in the slides.
Not yet. I mean,
we can see it, Tobias.
Okay. Excellent. Okay.
Okay, then sorry for the confusion, but here is just briefly the slide about Roche. I do not want to give you the talk about it again, but just that you saw it, the two wonderful towers. And now we should move on to the next slide, which is introducing DCP, the Data Computation Platform. And DCP is designed to be a modular global system where we can integrate various mathematical approaches and visualization approaches. We did spend probably 6 years in developing that now, or 7. And our goal is to have very well-defined workflows that we can standardize the way we're using the tool across the entire manufacturing network. One very important thing here is that DCP is going to enable data-driven decision-making and that it's ready for GxP use. So we validated most of the parts there. And when I say we, I refer to this to our group of Open GMP, DevOps, and Innovation, which I'm heading or which I'm leading. And there you can see the individuals who work together with me on the topic. For sure, we also have external partners who help us in writing the software or creating some test cases and documentation around it. But nothing would work without the local site teams, which is a nice transition to the question where DCP is available across the globe. And DCP is rolled out to all our drug substance sites, Basel, Oceanside, Penzberg, and Singapore, as well as to our drug product manufacturing network, Hillsborough, Kaiser Augusten, Mannheim, and Rio de Janeiro. Recently, also development sites in Pennsburg and South San Francisco started using DCP. And also the second division of Roche, diagnostics in Pennsburg, started now to figure out if they can use DCP for their purposes. In this slide, I would like to introduce DCP technically from a higher perspective. We start usually with the data source. And here for us, it's important that we are not creating a data lake and a lot of copies due to data integrity issues that we want to overcome. So we want to avoid copies. And therefore, we're trying to connect directly to the data sources. That can be either on-premise solutions like the PI system, the data historian system, or SQL databases, but we also support the connection to different cloud environments like Google, Amazon, Snowflake, and so on. And from there, we are connecting to DCP Core in the first step. And this DCP Core layer enables the use of GxP and non-GxP applications under the same umbrella, just to increase the user experience. And it also handles stuff like event orchestration, so detecting that a manufacturing step or process started, as well as authentication authorization, tracking the validation status if you're switching from GxP to non-GxP applications and back, as well as ensuring that a meaningful audit trail is in place. You see now in the last step here that we are using the open source statistics software R to do a lot of our calculations, and you can define calculation nodes per site, also using the UI of DCP. On top of the DCP core layer, we have DCP Basic, which provides fundamental tools to perform process monitoring and analysis. That is something like real-time dashboards, or doing charting and simple analysis like batch clustering, so comparing if two batches were operated the same way. Additionally, we are enabling the users to create individual notifications. For example, if a certain sensor or measurement should not go above a certain threshold, if that happens or above the limit, we automatically send mails. Next would be sharing and collaborating. So not everyone needs to create the data visualizations from scratch. We can share it and send it around to engage in collaboration. Since we're a global company, we need to have also the settings thing here that we're supporting different languages, different time formats, and so on. All that we bundled together in the DCP framework. And it turned out that this framework approach is helping us to save us a lot of costs due to synergies by this platform approach compared to separate applications. And it's getting even more valuable in terms of reduction of the validation efforts that we have. What also is important to see here is that we have distinct infrastructure for GxP and non-GxP applications, just to make sure that they are not impacting each other or crashing. On top of the DCP framework, we then have the individual DCP modules, which enable the advanced analytics, visualizations, or specific workflows. Here in this illustration, you see right now 4 different modules that we have. Today, in this short talk, we will go a little bit deeper in MVDA, which stands for multivariate data analytics. To make sure that DCP itself is not another isolated island in the company, we have an API service integrated into the system so that you can connect with third-party applications and consume the data that was generated in DCP. There are 3 important things that I would like to highlight. So the configuration is site-specific. That means each of the modules you can see here can individually be activated per site. Also, each site access to the data is manually organized to make sure that only the people get access to the data who really should get access. From technology perspective, everything in DCP is based on microservices. That means for front-end calculations, back-end as well, which enables us again to have individual development, deployment, and also validation, but at the same time allowing for reusability of those microservices. We heavily rely on a toolchain that we developed on an internal GitLab instance where we have CI/CD in place, which performs code quality checking, as well as automated building and testing and creating the reports for us. Moving to the use case that I prepared for today, it's about using MVDA, the multivariate data analytics for process monitoring. In this case, MVDA is there to support our real-time release testing aspirations. And we will take a look at a specific use case that was done at our manufacturing plant in Mannheim, a drug products manufacturing plant. And there we will take a look at the autoclave. But before we're going into this, I would like to introduce the approach of MVDA for process health supervision. To understand that, we first need to start with the approach that we typically use right now to monitor the process. Here illustrated the pressure curve, so the pressure over time during a run of an autoclave. And an autoclave is basically used to make sure that there are no, microorganisms in or on the material that we use for our sterile manufacturing. And what we monitor typically is here, for example, the pressure during a specific period of time. The pressure needs to be on that level to make sure that the goods in the autoclave chamber are good and ready for sterile use and manufacturing. In fact, we do not have just the pressure, we can also have the temperature, power consumption, moisture, and so on. And the more signals we get, the more complicated and confusing it can become to perform a univariate monitoring. And therefore, we are applying a mathematical approach, in this case, a partially square PLS regression model, to come to a multivariate approach. And what happens then is that we get here this physical meaningless score value that we can trend over time. The score value is condensing all the information or the majority of information from the underlying sensor signal. So in this case, moisture, power consumption, and pressure into one value that we can monitor. For sure, by itself, we do not see that much just based on that curve. Therefore, we can apply the same algorithm on historical good runs, so basically where we did not have any quality issues, and do the same mathematics. And with this, we get this greenish envelope, which indicates the expected good operating range. And we see now for this bluish curve here that it's nicely in that expected operating range, and we can claim that there are obviously no issues related to that manufacturing batch. If we're coming to the next one, this orange one, we see that it migrates somewhere out of the expected operating range, and we can flag it for sure as questionable. And we can do first investigations of what might be the root cause of that. And this happens by selecting the data points in that region, so in that red shaded area, and then a so-called score contribution plot will be opened. It's a super simple bar chart, and it's also easy to understand what we are seeing here. We see on the x-axis the different underlying sensor signals, and the higher the bar, the more different the signal was compared to what we saw in the good runs, which create our envelope here, our model. So we would start in this case with investigating the power consumption. How does all that now work in DCP? For that, I prepared here a video, which is a 4-step wizard. We are selecting in the first step the unit operation, the autoclave that we want to monitor. Then we're going for the sensors that we would like to monitor. In this case, for the model, in this demo case, I use 2 pressure and 2 temperature signals. We select the different batches that were produced in the past. We can filter to make sure that we only go for the really relevant ones, and then we are generating a data set. After providing a name to the model, we can adjust more advanced settings if required, and then the model gets generated. Here you get the summary of fit plot to see how good your model is, or here we now see the score values over time for those batches. In the end, we provide a short description of that model, and we can assign conditions to that model to make sure that it's only applied if certain conditions, like here in this case, the full is met, and that the model is not applied on different batches. In the end, you briefly saw also that the PDF report is generated for your reference, or that you can put in your electronic document management system. Now coming to the use case that I prepared. As mentioned, it's about the autoclave in one of our manufacturing units. You see in the upper left, we have the timeline of what happened. Everything was working as expected, but then we did maintenance, and afterwards the job floor reported that the goods in the autoclave remain wet, which is unexpected. In particular, if we're taking a look on the process illustration at the section below, where we see we have a cooling and drying phase. At the bottom, you can see a simplified visualization of that autoclave. So you can see that there are 2 temperature and 2 pressure sensors. we used those four sensors and generated 2 additional sensor signals by creating the temperature and pressure difference. Based on that model, we can capture with, as you can see in the summary of fit section, with 2 principal components, we can capture more than 60% of the model variance, and we are claiming that this might be sufficient to monitor the process. In the upper right, you see the score plot with all the batches that were used to create the model. Okay, now here on that larger or enlarged chart, you can see the model that we just generated, and those greenish patches are all those during the period of time when we did not have any problems. And now the next ones that I will show are immediately after maintenance. And here they are presented in red because they are all out of our expected operating range. And if we are now starting to do the investigation, what went wrong, we can zoom into that cooling and drying phase. So from the time we know roughly where we need to take a look. And what we can see here now is that all the pressure-related signals are showing the highest bars. That means there's something wrong with the pressure signal. And if we click on one of those bars, we are getting the physical meaningful, so the underlying sensor signal. Now you can see on the y-axis, we have the pressure signal 1. And if we zoom into the end of that process, then we can see that there's a significant difference between the different batches. While the greenish batch is showing a nice step increase, the other ones are showing a linear increase. And with this information, going back to the job floor, asking what happened during maintenance, they quickly figured out that they thought they made a like-for-like exchange of one of the pressure regulators in the autoclave. But it turned out it was not completely like-for-like, and we need to provide new parameters to that pressure regulator to get everything back to normal. So we can conclude that with such a model, we can immediately see that something went wrong. Talking about validation. So how do we validate that? The DCP itself is validated, the framework as well as the MVDA model is validated as well. And in the next slide, I would like to introduce our validation strategy, which is aiming for an end-to-end validation. So that starts with validation of the framework, which I introduced earlier. So we need to go through a CSV approach, computerized system validation for the framework itself. That requires for sure qualified infrastructure, but is in general site and process agnostic. As soon as we're coming to one of the modules, here in this case MVDA, we need to have for sure a validated framework. And then we need to go through the CSV approach for this specific module, which consequently is then module specific. With MVDA, we have another validation that we need to conduct in this case, the model validation. And here to clearly spell it out, it's not CSV, so no computerized system validation. Instead, the goal of the model validation is that we demonstrate that the mathematical model performs as expected. And this is then equipment and potentially also site specific. As soon as we're embedding that into the business process and have a validated data source, like the PI system as it is in the Roche network, we have an end-to-end validation of the entire process. Also for this one, to show you how the validation works then in DCP, I brought a short video. So after having the model in place, we can click on validate and we define a model intended use as well as a short model description. We can also define the statistical acceptance criteria, which you need to align on with your quality partner. Then you can select from real-world batches that were executed. In this case, you can see that you cannot pick those which are part of the model already and define if those batches should pass or fail. Sometimes we're running into the problem that we do not have enough real-world batches available, in particular with issues, because luckily our manufacturing is often not running with that many issues. And therefore we can simulate some batches. Here you see that we apply changes after a certain period of time on the underlying sensor signal, and then we can define again if it's passing or failing. Afterwards, you can download the validation plan, which you can put in your electronic document management system. And what we do as well is we are hot linking the approval state and the version of the document in the EDMS, so in the electronic document management system, with the specific model in GCP, just to make sure that you cannot withdraw the document and the model remains in GCP still in the validated state. Moving to the last part of my talk, which is about open sourcing GCP. So we are planning to open source more and more pieces of GCP because we believe and we commit ourselves to innovation, and we think that this is only happening with transparency and if we are collectively working together on that. And how we are approaching it right now is basically the following. To implement a new technology, you often or usually you need more than just the technology piece. You also need to have the people and the process in place. So while GCP and the modules can help you to solve some of the GxP related technology issues and challenges, it still remains super crucial that we have a good mindset and culture and end-to-end thinking in our organization. And that's where we as Roche think that we can learn from the industry and drive a smarter pharmaceutical manufacturing together. For sure, having the approval from management is not just easy to get for open sourcing something like this, where we, as I said, initially did spend 6-7 years on developing it and continue to develop it. But opening this box of open sourcing means also that there was not a clear process in Roche established to open source something. And this comes then with the problem like intellectual property rights, confidentiality and trade secrets, or also the license compatibility. Because we're also leveraging open source packages, we need to make sure that all that works together. But we overcame most of those hurdles, and therefore I'm happy to share that you can learn more about GCP by visiting open-gcp.ai. The software code is available on GitLab, also under the Roche domain, but you can get there from their website. And we already published an extensive developer documentation around GCP. All right, with this, I'm at the end of my talk. And I'm looking forward to invite you to pioneer open source GMP analytics for a more accessible, enjoyable, and productive data-driven future. Thank you.
We are open for questions. Yeah, so Tobias, we have a question. Which modules are available within GCP?
So right now we have internally, we're working on 6.7. What we started to publish now is with the framework itself, and then Chrome TA is published. Next one will be most likely MVDA, so multivariate data analytics. Then we have a dedicated one for chromatical feed transition analysis, which is Chrome TA. We have a simplified analytics workbench, which is SAW. Then we also have DREAM, which stands for Dynamic Reporting of Advanced Manufacturing, which is generating PDF reports in a validated way. So there are several available, more internal even on top of that. But if you're interested in details about those modules, I would recommend to take a look on open-gcp.ai. There are the different modules described in detail as well.
Yeah. Thank you, Tobias. There's one more question. How is the data versioning done? And how is that validated? And can you please throw some light on these?
How is the data versioning done, you mean?
The versioning of the data. So how is the data stored in versions? So
Okay.
you have a set of data, version 1, version 2, version 3, and so on.
Yes, sure. So the data, the underlying data itself is not stored in GCP. As I tried to point out, it's stored in the PI systems, which are from AVEVA, and they are validated systems anyhow. What we are storing in different versions, and including audit trails and so on, is, for example, dashboards that someone creates or mathematical models that someone creates. Those are all versioned, so that means each change is recorded in the system. We're tracking that. Then also all admin actions are traceable so that we have a complete audit trail to make it completely GMP and GxP compliant. Yeah.
Yeah. Okay. Thank you, Tobias. I think that's it for the questions. Thank you very much for the session.
You're welcome. Thank you.
Thank you.